Hi everyone, my name is Rachel, and today I'm going to discuss the healthcare programs of the United States and Denmark. First, I'll talk about Denmark's health insurance and what they offer. All Danish citizens are eligible to receive Denmark's free, universal, and equal healthcare insurance programs. It is funded through taxes and operates across three financial administration levels. 84% of its healthcare is publicly financed. The other 16% comes from patient co-payments if they do not have the free universal healthcare, like if they paid for a different one. Or the other 16% comes too from specialist visits that are without a referral. The types of care that are covered are free primary care, specialist visits, hospital care and stays, mental health services, preventative care, and long-term care services. Residents may purchase voluntary complementary insurances to cover their co-payments, or if they have outpatient drugs, dental care, or other services. And then the United States, their health insurance is you have to be a U.S. citizen to be eligible. It is funded through either government-assisted insurances, which are Medicare, which is for the elderly and disabled, or Medicaid, which is for qualifying low-income families. Or you could pay for your own insurance completely out of pocket. Or if you work for a company, a lot of them offer health insurance programs where you pay a part of it and they pay a part of it and it's split, or you just pay for the whole thing. And then the care that is covered in the United States depends on the health insurance program. They will vary amongst different programs depending on what is offered to you. So there will be a variation across all different programs, but a lot of them, again, it depends on the copay. There's different deductibles, there's coinsurance, so they'll vary. So the quality of healthcare in Denmark is actually pretty good. They have a reputation for having great quality healthcare system. And when residents go to the hospitals do have to be accredited by the Danish Institute for Quality and Accreditation in Healthcare. So that kind of helps the Danish citizens put a little bit more trust in the hospitals, knowing that they have to meet a certain level of criteria in order to be open. And there's numerous benefits for the citizens. As I mentioned previously, that they get free primary and preventative care, specialist visits, long-term care, which is a big perk. So overall, it's just really good quality in their healthcare and that they offer. And comparing that to the United States, most Americans are actually not pleased with the quality of healthcare that they receive. A lot of times there's long wait times. There is a physician shortage. So it might take a while if you need to make an appointment to get in. And many Americans would like to see improvements to the current system. They're just overall would like to see changes. Next, I'll talk about the levels of satisfaction with Denmark's healthcare. Danish citizens are highly satisfied with the current healthcare system that they have. They do have care available 24 hours, 7 days a week. And it is the highest public satisfaction rate amongst all countries. They strive to ensure that everyone has a primary care physician, and general physicians are responsive and they try to provide quick services, and they strive for same-day appointments. That really can increase the level of satisfaction, and the citizens know that their physicians do care and they do listen to them, and they try to get them in to get them help as soon as possible. And the levels of satisfaction with the United States, again, most Americans are unhappy with the healthcare system. 16%, there was a survey done by ROAR where 16% of the respondents in the U.S. said that minor changes to healthcare were needed to be made. And 34% said the system just needed to be rebuilt completely. Out-of-pocket costs, the U.S. is an outlier, with most of a third paying $1,000 or more each year. One of the respondents in the survey said. A lot of Americans have high deductibles, so they have to pay quite a bit before their insurance will help them, or they have to make a copayment for every visit to the doctor's office that they have, or prescriptions. So that kind of just puts that satisfaction rate lower, just because there is more cost to them to receive, basic health care even. So the health outcomes of Denmark. The life expectancy in Denmark is 82 years old. The infant mortality rate is 3 per 1,000 births. The vaccination rate, 81% of the population is fully vaccinated for COVID-19. And the leading cause of death in Denmark, the two top are cancer and cardiovascular disease. And then in the United States, the life expectancy is a little bit lower. It's 77 years. The infant mortality rate is 5 per 1,000 live births. The vaccination rate for COVID-19 is only 68% of the population is considered fully vaccinated. And leading causes of death are actually the same in the United States as it is in Denmark, and that is cancer and cardiovascular disease. There are current threats to Denmark's healthcare system. There's chronic disease, which, physicians and doctors and healthcare workers are every day are trying to provide services to help people manage their chronic diseases. Obesity is a threat. A lot of people struggle for that and get healthcare to kind of help them. Alcohol consumption is very high in Denmark. Most of the citizens there is a high percentage of citizens that consume alcohol. And then, like I mentioned before, there is a physician shortage. So they are striving to hire more doctors and get to make sure that, everybody can keep that high level of satisfaction and just get people in to see the doctor when they need to. And the threats to the United States healthcare system, they also have chronic health issues and obesity. They have antibiotic resistance. That's, with overprescribing antibiotics or prescribing them, eventually there becomes resistance. So they are fighting to try to find antibiotics to cure certain bacterial infections. So they're striving every day to find new ways to go about that. The opioid crisis is going on in the United States, and the United States also has a physician shortage too, which, like I had said before, it's leading to longer wait times. People are having to travel just to see doctors when that those services are not offered close to home. And there's a burnout of healthcare workers. Since the pandemic, there has been the highest level of nurses leaving their professions. A lot of them are just burnt out. There's just not enough staff, so a lot of people are working insanely hours. And it's not just nursing, medical laboratory scientists, there's a huge shortage of them. So the people that are currently working, they're getting tired as well, working all these extra hours to make up for it. So that is a threat to the United States healthcare system, because of overall just all their workers are getting lower. And the high cost of healthcare. Healthcare is pretty expensive in the United States compared to other countries. So a lot of people may not seek out healthcare just because of the costs, and that can also affect the chronic health issues. If people have, diabetes or heart disease, they're not getting to see their doctors because they are worried about these high costs. So thank you for listening. I hope I explained the differences between the United States and healthcare pretty good. So thank you for listening.